Okay, thank you. Thank you, Mr. Chairman. It's a pleasure to give a talk of the new technology. Of course, I have a conflict of interest because I'm in contract with Olympus Tokyo for 25 years for development of NBI. But as a president of the World Endoscopic Organization, I have no conflict of interest. I'm going to talk about all the technology. So, why have we improved the endoscopic imaging? What for? First of all, it's important to improve detection. And definitely, when we use high-resolution scope, we are much better to detect any minimal color change, any minimal relief change. That is really important. And when I'm talking about high-resolution scope, I'm talking of scope marketed for the last 4 years. Before, we have a good scope, from fiber to video scope, but really high-resolution scope is the last generation marketed from about 2010. Second point, for the endoscopic imaging, what is important is characterization. And it's really a breakthrough. For many years, we improved endoscopic diagnosis for detection. Now we are able to do at the same time, during the same session, detection and characterization. And characterization is very important because we analyze it of a superficial vascular network and assessment of mucosal pattern. For the beginning, we were just talking with assessment of mucosal pattern. And it's when we start to develop NBI in 2002, we look for mucosal pattern, like Shenyo-Kudo pit pattern. But since 10 years ago, thanks for the Japanese colleague, we know there are two things to assess. First is mucosal pattern, but it's also superficial vascular network, and that is really important, I know. What for? What for is the clinical benefits, the clinical management for the patient? So, with this new imaging, with characterization, we are able to detect benign without malignant potential, no treatment. Hyperplastic polyp in the rectal, you see, you diagnose, you forget. That is a really important point. Second, benign with malignant potential and is endoscopic treatment, or even instead now is endoscopic treatment without pathology. Used in Europe and most part of the world, we remove and we send to the pathologist, even if we know it's a benign polyp. Instead, for economical reasons, they move forward, they remove a polyp, adenomous polyp, and they put away without further pathological examination. And the next step, malignant with invasion limited to mucosa and submucosa, and it's really part of my talk today. We have two possibilities, endoscopic treatment or surgery. It's why characterization is very important. And of course, when it's obvious malignant with deep angles, we send to surgery. So, how could we do that? First of all, I should remind you, the quality of imaging endoscopy is very hard for the engineer. It's like a Formula One. You improve one feature and the overall result is impaired. And it's very important to know that resolution 1 point, magnification power, contrast, angle of view, depth of field, illumination, automatic gain control, noise, everything is connected. And when you improve one feature, you should improve the global picture. And you know, the number of pixels is just one. When they say, oh, we have 2, 4, 10 million of pixels, it means nothing. It's all the electronic part is not adapted to the number of pixels. That is why it's very tough to improve the endoscopic imaging. It's really like a Formula One car. You know, start of the art of endoscopy imaging, high resolution scope to improve detection, and image and endoscopy It's an endoscopic classification for characterization treatment. You should remind that there are multiple possibilities with digestive endoscopy, and on this chart published by my friend Issa Utajiri and Professor Niwa, it's very important to know what we are doing. And here, with enhanced imaging, we are just one part of this, we have just one part here of this improvement, but there are a lot of possibilities with digestive endoscopy. So, modern endoscopy, what we are talking about? We are talking about high resolution scope, I told about. Sequential doesn't matter. If you use CCD, black and white CCD, color CCD, but it doesn't matter. This is the overall result, what is important, and they are very similar. What is really important is the last step during the last couple of years. In the past, we have Olympus, NBI, which is optical technology, and Fuji and Pentax, they are a different technology. Now, if you use NBI from Olympus, if you use BLI, CLI from Fujifilm, or optical enhancement from Pentax, it's exactly the same result. That is very, very important for classification. It's very important for daily practice. If you read a paper on NBI, you could do and reproduce the result of this paper using BLI or Pentax. That means the whole community work at the same level, the whole community will speak the same language. It's very important. Because in the past we have structure enhancement, FASGE and iScan. Structure enhancement, FASGE and iScan is Photoshop. You have a picture and you could modify the picture. NBI, BLI, optical enhancement is optical, it's a real part. And of course we have magnification, and of course we have a wider field of view. Another important point, everybody forget, if you buy high resolution scope, you should have a high resolution screen, because it's like a soundtrack. If you have a good speaker and a poor reproducer, the overall result is the lower part. So that means it's really important when you have high resolution scope to have a high resolution screen. Because if you have a poor screen, you miss the benefits of high resolution scope. That is really important because, you know, scope and these scopes are very expensive, and sometimes you need to say we could save money on screen. If you save money on screen, you destroy all the clinical benefit. And it had been shown very nicely in a paper on digestive endoscopy to show the benefits of this Pentax last generation for detection with a screen, with a better screen than a smaller. You know, everybody knows the principle of NBI now. The principle of NBI is very, very simple. It's we are looking for. Yes. Okay, I get it. So we are working here. White light, RGB, and this is the NBI with wavelengths, very narrow wavelengths on blue and green, and depending what you are using, if you are looking with a red, it's a deeper part of the digestive wall. If you are looking with the upper part, you improve the visibility of the superficial part of the digestive mucosa, and especially for mucosal pattern and vascular pattern. Another point what is important, it's the close view. In the past, in Japan, they developed a zoom scope, and zoom scopes are very familiar in Japan. So you have an elevator, and you could enhance the picture. But you know, the problem with zoom scopes is very difficult to handle, and by using a zoom scope, the focus is very, very narrow, and you are very frequently out of focus. These zoom scopes have never been popular outside Japan. And it's why talking with the engineer, Japanese engineer, using zoom scope, I told them, you know, this elevator is, you know, it's not adequate for people outside Japan. We should have something easy to use. And now we have just a button. And so that means you press a button and you have the usual mode here, and you press a button and you have the magnification easy to use, and it's why it should be more popular, because you cannot assess properly, we cannot characterize that properly if you don't have the magnification. And this is, if it's works. Okay, this is an example. We use a high resolution scope. I move to NBI. You see we are in the antrum. You could see very closely the mucosal pattern. What is dark is a vessel. That is regular. Everything is regular. I move here and you see here some abnormality is intestinal metaplasia. Coming intestinal metaplasia here, and you see all the detail of this gastric mucosa. That is a normal aspect. Now, thank you. Now, it's another patient. It's not a Japanese video, it's a video from my department, and you look very carefully in white light, you see the same antrum. Looking here, and you see this really small anomaly is very, very narrow. It's less than 1 centimeter. But you see here, we have some irregularity. I move with NBI, and you see with NBI, close view, deep part, vessel here, and no vessel here, no vessel at all here. Destruction of the mucosal pattern. This is an aspect of superficial gastric carcinoma from European ladies. And of course, this had been removed by ESD. So that is really the benefit of this new imaging. I diagnose and I assess that is superficial, and at the same session, ESD could be performed and removed. So that means when we are talking about new imaging, it's not just a fancy scope, it's a clinical benefit for the patient. At the same time, you are able to make very clear diagnosis and to assess and to treat. And instead of sending a biopsy specimen to the pathologist, I send the full specimen, the full endoscopic resection, like a surgeon. When you do that kind of therapeutic endoscopy, you are a surgeon. Other technology, optical enhancement for Pentax, of course, is totally different from eye scan. There are two possibilities. One mode is a blue and green filter, exactly like NBI and BLI. And what is quite interesting from Pentax, they develop also a second mode. We enhance white light for improvement of detection. That is something very interesting from Pentax. Technology exactly the same. It's an optical filter. Two possibilities with a NBI-like mode or this new mode for white light. You see here, you have white light, but something you have improved for detection. And this is the NBI mode. That means you have one filter for blue, one filter for green, like NBI, and you have some specific filter from red in order to enhance the visibility of abnormality in white light. And look about the result. You know, the results are quite similar. White light, high definition, NBI, and so on. BLI, exactly the same. Optical technology, overall result. You have white light, you have BLI bright, which is larger, and if you increase the resolution and if you increase the magnification here, the detail of the mucosal pattern, the detail of the surface pattern, and what is dark? The dark part is the vessel. That is very important to assess the vessel, and you see here. Again, if we use the BLI optical magnification, you see here all the details. That is really important. As I show you in the video, here is regular, here is irregular. Here you could see the dark part is a vessel. They are enlarged, distorted. That is already means pathological of some pathological area of the mucosa. And here there are no vessel at all. But this is really a typical aspect of superficial gastric cancer in Japan. Move to the colon, because this technology is applied also to the colon. This technology on the colon is nice classification. Nice classification, we have 3 types of classification based on color, vessel, and surface pattern. And for the 3 item, we detect what is most likely for the pathology. First, the color. Type 1, here, same for the background. You see this small abnormality and the background, they have the same color. The vessel are totally similar. And, they have no dark part. So that means this is a hyperplastic polyp. On the color, vessel, surface pattern, hyperplastic. If we are looking about type 3, type 3, you have the brownish aspect is totally different from the surrounding mucosa. They are disrupted and missing vessel. They have absence of surface pattern. That means it's a deep submucosal invasive tumor. So here we leave, here you send to the surgeon. What is important is in between, is type 2. Type 2, you see again, there are some brownish aspect, but the vessel, the structure are regular, and this is the aspect of adenoma. And it's important. I will talk later on about nice classification on this morning, and it's why we detect type 2, type 3, but it will be for later on. So, what is the importance of this new classification? The importance of this new classification, it's improvement of the detection. And in the past, we used to say, and the past is until a couple of years, we used to say white light is better for detection. NBI does not improve detection. But with a new NBI, with a new BLI, with optical enhancement, now we have some studies from UKC Sano, and this study from Sano, they show very clearly white light detection and NBI detection. That means with a new NBI, with a new BLI, with optical enhancement, we could expect not only to allow characterization, but also to improve detection. And that is really important for colorectal cancer screening. It's also important for gastric cancer. But in esophagus and gastric, most of the endoscopies, they do the diagnosis very accurately. What is important is for the colon. We know, even the best endoscopy, we are missing some colonic polyp. And adenoma rate detection is one of quality assurance criteria for colonoscopy. And it's very important that the endoscopic manufacturer improve the technology in order that the average endoscopists have a tool to improve detection. It's very important. And this is with BLI in other studies. First study with NBI, second studies with NBI, and again, these studies show that with a new technology, we improve detection and allow characterization. So, what is the future? And when I'm talking about future, I'm talking about tomorrow. I'm working for the development of next generation scope, and what we could expect. Again, scope is like your smartphone. Next years, you will be a better smartphone than this year, because the technology, especially the sensor, are increasing quality for many years, and every year. So high resolution, more brightness. Now we will bring to endoscopy the 4K technology. That means we have a more accurate image. We should improve white light imaging, as already Pentax doing. BLI, CLI also is doing. That means on white light, we try to spot some irregularities, so color change, and of course you have to teach your eye and your brain. What is the most important and very promising? It's a computer-assisted diagnosis. There are some tools in development that mean during your colonoscopy, the computer put an arrow and tell you, look about that. And it's a real-time computer. You are doing your colonoscopy, and during colonoscopy, you have an arrow saying, look at, and it's an abnormality. The difficulty is the accuracy. If you have too many arrows for nothing, false positive, you forget. But the tool that I know, they are quite sensitive, quite specific, and it's very important. That means if this tool is coming on the market in a couple of years, all average endoscopists have a real diagnosis help for the computer, and I think it's really important. Of course, we have 3D, and we develop also, the Japanese engineer, they develop multi-filter on wavelength. NBI, we look about superficial filter, but also we could develop some deeper filter with red in order to look at a large vessel. When we do ESD, is a surgery. Sometimes we have a large vessel, we have to coagulate, to clip a large vessel. We have perforation, it's not a perforation, we put a clip on, it's part of the surgery. But it will be very interesting when you do ESD, if you see some very large vessel on the mucosa in the digestive wall, and detect by the endoscopy, and you have better clipping or better coagulation forceps to use it. So that means, the present and future, it's important of high resolution scope and use this new scope, this new technology in daily practice. One of the drawbacks, it's most of our colleagues, they have a new technology, but they don't use NBI, they don't use BLI, they don't use optical enhancement. When you have this technology, you should change your mind. You should work with a new classification, new technology. And of course, what is my main message, whatever you work with Pentax, Fuji, or Olympus, you have the same technology, but please